Today, I'm excited to talk with one of the winners, Aubrey Kelly with Rabble Health, and learn more about the idea, its inspiration, and the innovator behind it. Aubrey, thank you for being here.
My pleasure, Dr. Richardson. Thank you.
So before we dive into your idea, can you share your personal experience with cancer?
I can. So on April 7th of 2017, my son, who at the time was 22 months old, was diagnosed with acute myeloid leukemia. And for those who aren't familiar, it's the pretty, in the context of blood cancers, it's the pretty rough one. He had a successful bone marrow transplant, and we were able to celebrate his 6th birthday just a few weekends ago, actually. These are milestones. There were a certain part of time when I wasn't sure if we were going to be able to hit these. So it's important to just acknowledge those milestones and celebrate them.
Please give us an overview of your winning idea.
Our winning idea, which I'm really excited to share about, is an opportunity to say, you know what, if we take, and maybe we're not all aligned on empowerment, so let me take that first. Our definition of patient empowerment is loosely based off of the WHO's definition, which is enabling patients to have greater control over the decisions and actions impacting their care. We want to help move more patients from educate to engage to empower. And we want to take a very disciplined, evidence-based approach on how we can do that for more patients. We are a consumer-facing digital platform to be able to help not only cancer patients, but also their caregivers, the family members, the loved ones, the friends and family, to be able to access the relevant information that's available to them. The platform's called My Rabble. It's available as an iOS app, an Android app, and a web app. We're a seed stage company. We have a lot to learn, but I just felt that there was an opportunity for a digital health player in this space.
How do you believe this will empower those in the community, the cancer community? What I was just saying, how will we go beyond just educating people and moving them to decisions and empowerment?
So if I think about education right now, what are our metrics of success? How do we actually take an evidence-based approach and say, did that patient truly access the services that they need? Were they able to effectively communicate their goals of care? There are tools to be able to help patients and caregivers get through. And through that, they're able to get greater control.
As a provider, it really is, how do we help people understand as well what they're up against? Because you really cannot make a plan until you understand what I'm telling you as a medical oncologist. So I really appreciate that. And I think your program probably works on that angle as well. Is that true?
That's it entirely. It's intended to be a vehicle for shared decision making.
So in your opinion, why does empowerment matter in the prevention and treatment of cancer?
There's a ton of disparities actually in the context of genetic testing. Cancer disparities do not impact kind of all people the same way. Those individual patients actually in the community setting, in the kind of outreach area, and saying, look, there might be localized kind of resources that you're not necessarily activated into in terms that can really help you manage through your journey better.
Thank you so much for bringing up disparity. So I'm very happy to see that Rabble Health is aware of that and working on that angle of the problem as well. Do you hope your idea will change the future of cancer prevention and treatment?
I think at the end of the day, a cancer diagnosis is not a positive thing. So we want to be known as the platform, the consumer-facing platform for any cancer diagnosis. We have a long way to go from there. But our hope is that by being able to help support patients through diagnosis, treatment, recovery, survivorship, potentially even transition or a relapse, that patients feel that they are being able to go through their journey with fewer regrets.
So how do you see your platform informing prevention as well?
So when we talk about cancer prevention, when we talk about kind of empowering individuals to kind of take ownership of their journey, there's a lot that we can do in the context of actual genetic testing, understanding what risk profile individuals have, and start taking a much more proactive way to address some of those factors.
That was very nice. So congratulations, Aubrey and Rabble Health. Ideas like this one will help us develop tools for empowered health program and improve cancer outcomes for all. Thank you for being with us, Aubrey.
My pleasure. Very excited to be part of this cohort, so thank you.